So as Premier indicated, as part of the national plan, Victoria and other states have agreed to be part of a home-based quarantine trial, and the view of the public health team is that that is best to start with the lowest risk group, that being those Victorians, several hundred of them, who have been in the border bubble areas along the Murray border bubble, but on the New South Wales side. And those risks, I think, have been highlighted today when we've seen New South Wales hit both a record number of cases and, sadly, deaths associated with COVID-19, highlighting the extreme risk nature of the New South Wales outbreak and the threats it does pose to Victorians. So we need to be able to manage those in the best possible and safest way, while still bringing Victorians home in a series of steps. So as part of that national plan, the first of these pilots in Victoria will see at least 200, but it's probably a little bit more, of those Victorian residents who've been stuck on the New South Wales side of the border, to get them home safely, but to do it in a really measured way. So Victorians who have been residing in the New South Wales local government border area for the last 14 days, that is from the 25th of August to today, the 8th of September, will be able to apply for a new permit exemption category, Victorians in the cross-border community, to come home. Those applications will open this Friday, and they will be open for 7 days to get people into the system, closing at 6 p.m. next Friday, the 17th. Victorians applying for this exemption will need to do a range of things. Firstly, establish, obviously, that their primary residence is in Victoria. Secondly, evidence of a negative COVID-19 test result in the 48 hours prior to their arrival in Victoria. Thirdly, that they have evidence of having received at least their first dose of the coronavirus vaccine. Fourth, proof of not too restrictive means about how they have been in that New South Wales lower risk border bubble for the period of time over the last 14 days, and they've stayed within that. QR code check-ins, receipts, evidence along those lines. And finally, that they've maintained minimal social contact distance arrangements whilst in New South Wales, and in particular they haven't been in and out of the border bubble into the riskier zones further north. Victorians will be able to apply for this exemption via the Services Vic website, and we will seek to turn those around in 72 hours. Each of them have to be considered on their merits. Once through, we want to make sure that people go home as directly as possible and as safely as possible, with no or minimal stops, fuel obviously being an exception, to get them home. And then once they are home, continue to isolate for a further 14 days as per home quarantine arrangements that will be trialled through assistance from and oversight from authorised officers and other support measures. Obviously, if that engages people who also share that house or that residence, they will also be required to quarantine with you in that period of time. Other Victorians who aren't in that border bubble and who haven't been there for 14 days, we'd urge you not to rush to the border bubble, because you won't be eligible in this first iteration of the program. We know that there continue to be a whole range of cases that are still being processed around end of life, urgent medical treatment, urgent care, and they are being dealt with progressively. And other cases are being declined on the basis that there are other options available to people. We will get through those processes, and once we've looked at further prospects of trials, some technologically supported as per the wider National Cabinet home-based trials, we want to make sure that we then move from this lower risk area into the higher risk areas of New South Wales and get those Victorians back safely, progressively. We do apologise for the discomfort and the disruption that is causing many Victorians. But as we've seen today, the risk in New South Wales grows, and the last thing we want to do is import that risk, however inadvertently, into Victoria and make our already challenging situation even more difficult. We will work through this initial trial in the low risk areas. We will continue to work on other solutions and other methods to get those other Victorians home as soon as we can. Again, we apologise for the frustrations and the difficulties that it's causing, but we will approach this in good faith and get Victorians home safely and as quickly as we can. I might hand over to the Chief Health Officer now.